Students, today we'll start with a new lecture, that is your adverse drug reactions. Adverse drug reactions, we can say a adverse effect which has any undesirable or unintended effect that occur after the drug administrations, or we can say any untoward medical occurrence that may present during the treatment with a medicine, but which does not necessarily have a causal relationship with the treatment. All the drugs that are capable of being produced an adverse effect whenever the drug is given is the risk is taken. So the magnitude of risk has to be considered along with the therapeutic benefit of the patient. So the adverse drug reactions can be divided into five types. So the five types of the adverse drug reactions is the type A, that is augmented, type B bizarre, type C chronic, type D delayed, type E is the end of the use. Okay, as the name suggests, the similar with the meaning. Type A is a augmented. Augmented is sudden, unpredictable. It is divided into side effect, toxic effect, secondary effect, but it can be reduced. Type B is a bizarre, which is unpredictable, which cannot be, which has a little chances to come back to the normal position. So the bizarre can be allergic or idiosyncratic, which is a genetically mediated, and allergic reactions are basically immunological mediated reactions. So these are also classified into four type. Type 1 is anaphylaxis. Anaphylaxis is example of penicillin or lidocaine. Type 2 is a cytolytic reactions. Examples are antigen antibody complexes which activate the complement which complement the system. Type third is the Arthur's reactions, in which the antigen antibody complexes actives the initiates vasculitis. Example can be a sulfonamide. Type 4 is a delayed hypersensitivity reactions, which is a T cell mediated contact dermatitis. Example can be a penicillin. Next is the type D, that is a delayed reaction, delayed adverse reactions which occur some after taking a drug, and it will occur the reactions after some time. Type E is the end of use of the reaction, when we stop the medications and after some time it will show the reaction. Next, we will see different types in detail. First reaction we have stated, that is a type A, that is augmented, which has been seen as a predictable reactions, and they are more common and dose related and can be preventable and are related to non pharmacological effect of the drug. That's why it is being said a reversible adverse drug reaction. Example can be hypertension due to beta blockers. Next is the side effects. They are unwanted effect that are extension of the pharmacological effect and are seen with therapeutic dose of the drug, like in hypoglycemia due to the insulin, or hypokalemia can be occurred following the furosemide of the drug, furosemide drug, which is used for a diabetic patient. Next is this toxic effect. Toxic effect, we can say it is a result of excessive pharmacological action of the drug due to the overdose or the prolong of the drug. The CNS, CVS, liver, kidney, skin and blood forming organs are commonly involved in this type of drug toxicity. Example is morphine, which causes a respiratory depression in overdose, which can be a fatal. Next effect is the secondary effect, and they are the indirect consequences of a primary drug action. So example can be super infections, or they are indirect consequences of primary drug actions, And super examples can be super infections on the treatment of primary infections by broad spectrum of the antibiotics. Next class is the type B, that is a bizarre, which is a unpredictable reactions, and these are less common, non dose related, and are an abnormal reactions of the drug. Type B is basically classified in two, that is idiosyncrasy and allergic reactions. Idiosyncrasy basically related to the genetically determined abnormal reaction of the drug. If we see the reactions example, we can say barbitune or benzodiazepine or barbiturate, which causes excitement and mental confusion in some of the individuals, but these are being given to reduce the depression or anti-anxieties. Next is the allergic reactions. Allergic reactions are the immunological reactions which are not related with the therapeutic action of the drug. And the allergy is also known as hypersensitivity but does not refers to the increased response, which is also known as supersensitivity. Some manifestations of allergy are seen mainly on the target organs, which is skin, respiratory tract, uh, GIT, blood and blood vessels. Next type is the type 1, which is anaphylaxis. Anaphylaxis are the drug that induces the synthesis of immunoglobulin E, which are fixed to the mast cells. On subsequent exposures, the antigen antibody complexes causes a degranulation of the mast cell by releasing the mediators of influencers, like the histamine, which is our inbuilt antigen. Next is the type 2, that is a cytolytic reactions, the drug that binds to the protein and together they act as an antigen and induces the formation of antibodies. The antigen antibody complexes activates the competent systems resulting in cytolysis. Next is the type third, that is the Arthus reactions. The antigen bind to the circulating antibodies and the complexes are deposited on the vessel wall hole. It initiates the inflammatory responses resulting in vasculitis. Examples are your rashes, fevers are the Arthur's reactions. Type 4 is the delayed hypersensitivity reactions, and these type of reactions is mediated by T lymphocytes and macrophages. The antigen reacts with the receptor on T lymphocytes, which produces the lymphokinins, leading to the local allergic reactions. Examples are the constant dermatitis while handling the penicillin. Next class of the adverse drug reaction is the type C, that is a chronic adverse drug reactions, which is a continuous use reactions occur on a prolonged use of the drug, and both the dose and the duration of the drug influence the reaction. Example can be your chloroquine, which causes a chronic reaction, that is a retinopathy, in which the we cannot be able to see the things. Type D is the delayed adverse drug reactions, which occurs long after stopping the treatment and some the after the years, like the teratogenic effect. Next is the type E, that is end of the use of the drug, in which the effects are sudden discontinuation of drug after prolonged drug. Okay, so examples can be your angina after sudden withdrawal of atenolol. Next topic related to the adverse drug reaction is the pharmacovigilance. It is the science and the activities relating to the direction, detection, understanding of adverse effect or drug or other drug related problems. It deals with the epidemiology of the adverse drug effect. The main aim of the pharmacovigilance is to ensure the safe and rational use of the medicines. For that, they have to report the area is the duty of all the medical professionals, including the pharmacists. The adverse drug reactions which are reported and related is collected and assessed by the pharmacovigilance system and consisting of the centers like the regional national pharmacological centers, which is then report to the Uppsala monitoring centers. In India, the CDSCO in collaboration with the Indian Pharmacopoeia Commission, which is located at Ghaziabad, has initiated a pharmacovigilance program in India, that is PVPI, which consists of peripheral region and zonal centers for the coordinating the activity. Next is the medical colleges and the hospitals. They also report to these centers, and these centers collect all the data and send it to the monitoring center which is located in the Uppsala. Thank you.